the privilege of also welcoming pioneers of public health in this profession, and I'll name them one by one because they are gurus in their own respects. Mr. Alfred Malijani, Mrs. Christabel Malijani, Mr. Alan Rabson Mbewe, Mrs. Irene Kawe Phiri, Mr. Andrew Monakatambo, Mrs. Bernadette M.S. Mumba, Mr. Fortson Nyirenda, and Mr. Severino Tumbe Chisanga. These are veterans of public health, and we felt it was important to recognize them. They're actually here in our midst, and they will be making a presentation later on after lunch. Honorable Minister, Lehu is a brand new university, which is a private university, registered and accredited, and is offering training in public health, in occupational health and environmental health at the Bachelor of Science degree level and beyond. The theme of the conference, Honorable Minister, Repositioning Environmental Health for Enhanced Implementation of Sustainable Development Goals in Zambia, cannot come at a better time than now, given the various environmental health intricacies that the environmental health profession and Zambia are currently facing. Through this conference, it is hoped that a number of hindrances attributable to the non-recognition of the role of environmental health will be examined and unlocked. Well, I suppose unlocking is one thing and actually implementing is another thing. It is my sincere hope and prayer that the unlocking will translate into the actual implementation, not in a subtle way, but in a very pragmatic and visible way. In the recent past, guest of honor, environmental practitioners have been caught up in a web of invisible control, institutional expectations, and perhaps professional disorientation in the delivery of environmental health services. Perhaps also guest of honor, this is what could have led to the Republican President, Mr. Hakainde Hichilema, at a special interview conducted by Hot FM Radio on 19th August and carried live by various electronic media platforms, to have posed this very pertinent question, which I quote. He said, "Where are the health inspectors?" End of quote. In that interview, the President, Madam Minister, said that at the time that he was growing up, health inspectors were a very visible and practical profession who needed no introduction at all. And their work actually spoke for them by what they did. Environmental health practitioners need to be very assertive in their management styles and must have the ability to influence colleagues, subordinates, superiors, and society in a very positive way in order to attain set targets. Environmental health practitioners must bring about a more cohesive and responsive work style in the way that they implement environmental health management systems. Guest of honor, the environmental health profession cannot continue with the seemingly business as usual approach with the view that they will make a difference. I therefore personally call upon fellow environmental health practitioners attending this conference, including those who are not attending this conference but are in this country, to fully exert themselves and reclaim their once coveted glory in the place of promotion of public health and safety in this country. I call upon environmental health officers, our practitioners, to act with utmost professional integrity and credibility at all times, and not to fall into the temptation of unwarranted immoral vices that would dent this very noble profession. It is simply not worth it. In this day and age, guest of honor, environmental health practitioners cannot operate under the veil of ignorance. The world has moved into technological digitalized era, and hence I call upon all environmental health practitioners to rapidly and fully embrace the ever-emerging technology, not only as a way of moving with the times, but also to operate much more efficiently and effectively. Environmental health practitioners must work smarter and not necessarily harder. Shrouding oneself in ignorance will certainly be at the peril of that particular environmental health practitioner. Guest of honor, as a specialized tertiary institution, LEHO has committed to being the lead institution in research-based learning and will endeavor to provide evidence-based learning to all who choose to seek our services at this university. So therefore, guest of honor, this university, LEHO, seeks to be the lead institution in providing solutions to the ever-emerging issues in environmental health, in public health, and occupational health and safety. And in attaining this objective, guest of honor, LEHO has partnered and continues to partner with different entities locally and internationally to give our students the expected outcomes of their learning experiences. Guest of honor, it is not in dispute that our country, Zambia, urgently requires huge investments in research, innovation, and development programs. especially in the green economy, to answer to the many challenges that the country faces. And Leo actually aims to filling up that gap. Now, this deliberate emphasis on establishing what we call a green-aligned university, guest of honor, is in line with the Republican President, Mr. Hakainde Hichilema's erstwhile call on the Zambian citizenry to invest more in green economy and climate change resilience programs, much of which LEHO has been founded and will be involved with. In fact, it is a fact, guest of honor, that the specialized environmental health services or science programs that LEHO is offering strongly lean to this presidential directive. Guest of honor, it is imperative that new concepts and new ways of doing things in environmental health need to be actualized for the greater good of society, whom we so tirelessly strive to serve. Environmental health practitioners owe it not only to themselves, but to society. Guest of honor, society cannot have it any other way. Guest of honor, notwithstanding the legislative support at their disposal to carry out their mandate, which is seemingly not being fully utilized, environmental health practitioners can be said to be on a professional slippery slope and are taking down, unfortunately, national environmental health practice and benefits with them. Clearly, a fair amount of action or inaction on the part of environmental health practitioners are there to bear this out. Now, citizenry to invest more in green economy and climate change resilience programs, much of which LEHO has been founded and will be involved with. In fact, it is a fact, guest of honor, that the specialized environmental health services or science programs that LEHO is offering strongly lean to this presidential directive. Guest of honor, it is imperative that new concepts and new ways of doing things in environmental health need to be actualized for the greater good of society, whom we so tirelessly strive to serve. Environmental health practitioners owe it not only to themselves, but to society. Guest of honor, society cannot have it any other way. Guest of honor, notwithstanding the legislative support at their disposal to carry out their mandate, which is seemingly not being fully utilized, environmental health practitioners can be said to be on a professional slippery slope and are taking down, unfortunately, national environmental health practice and benefits with them. Clearly, a fair amount of action or inaction on the part of environmental health practitioners are there to bear this out. Now, in order to stem this tide, environmental health practitioners must overhaul their modus operandi so that the environmental health profession can once again become believable to society. But until that happens, guest of honor, environmental health practitioners are strongly advised to critically introspect, lest they become an irrelevant relic from the past, perhaps even a pre-dinosaur age relic. As for Zambia Institute of Environmental Health, through you, Mr. President, the sooner it accepts that environmental health practitioners' continued lamentations are a professional baggage, the better for it. Environmental health practitioners must not in any way rely on others to transmit any of their environmental health messages by advocating for media coverage. Environmental health practitioners must desist from blaming others in any shape or form for their seemingly inadequacies. ZIA, Mr. President, must use its immediately available and most readily resource, which is its own members, the environmental health practitioners, as well as the general Zambian citizenry, to go out and give it the necessary media coverage through its environmental health pronouncement and action. ZIA, Mr. President, must strengthen its advocacy team to continually and relentlessly engage the Zambian citizenry on why its relevance must be upheld and why it seeks the mandate of the Zambian people to lead all environmental health services in Zambia. Environmental health practitioners must create strong, vigilant teams at provincial and district levels, which must concentrate on talking to the local environmental health issues, obtaining at those levels, and relentlessly driving their message hard and proper. A difference must be seen and experienced. Guest of honor, to us in the environmental health profession, the coming in of the new dawn government, led by President Hakainde Hichilema a little over a year ago, has brought renewed hope to us. May I now, guest of honor, kindly address this directly to you. It's not a secret that the Zambian government, past and current, have spent and continue to spend huge sums of money on curative health services as opposed to preventive health services. Clearly, curative health services cannot be completely done away with. However, spending more money on preventive health services would certainly reduce the amount of money required to service curative health facilities. In that, environmental health practitioners would increase their efforts to ensure that diseases are prevented and that citizens do not become ill from preventable diseases. So therefore, my humble appeal to you, guest of honor, as a senior policymaker of the New Dawn government, is that you lobby your fellow cabinet colleagues to allocate more resources, financial and material, which will be directed solely at supporting environmental health services in the country. And I'd like to assure you, guest of honor, that the increased resources for environmental health services for this very important profession will not be in vain. This country will directly reap the benefits of improved environmental health services, ranging from better managed waste management services, improved food control, improved vector and pest control services, improved drinking water quality, better sanitation services, improved environmental pollution, improved health and safety standards of buildings, and so much more, Honorable Minister. Guest of honor, if this country is to make a difference in regards reducing the high levels of preventable diseases, including the now perennial cholera that this nation seemingly celebrates annually, I think a complete paradigm shift is required in the way that government resources are allocated to the health sector. And Minister, not in the future, it has to be now. Preventive health services at all levels must be prioritized, guest of honor. And I always question, why should a nation like ours always celebrate a fatal disease as cholera? It seems that we always look forward to cholera every year, year in, year out, as a nation. And I think it just sort of, it beats logic, to be honest. Perhaps, Honorable Minister, this is where the old adage of prevention is better and in so many cases much cheaper than cure. This is where it comes into play. Now, the Zambian disease burden attributable to preventable diseases must be addressed, reduced, and seriously curtailed. This would certainly be attained with the increased resources allocated to preventive health services. Guest of honor, the environmental health profession has confidence in the New Dawn government and is convinced that this government will do things differently and correctly. The environmental health profession looks to you, guest of honor, to be our strongest advocate and cheerleader as regards our plea for increased environmental health services resources. Fellow conference delegates, I personally look forward to your very, very active participation at this 3-day conference. And it is my sincere hope and prayer that the deliberations that will come out of this very important conference will indeed reposition environmental health for enhanced implementation of sustainable development goals in Zambia. The guest of honor, the Minister of Health, Honorable Sylvia T. Masewa, MP,